Good morning. We are going to do our job of explaining Medicare to you. Take as long as you need to follow. My name is Vicki Spritz. I'm a volunteer with Pima Council on Aging's SHIP Medicare program. Pima Council on Aging is the area agency on aging for Pima County. That first number up there is our helpline for all other issues regarding aging. It is the place to go when you don't know where to start. Then you can see our Medicare counseling number. You can call us or email us. We generally do not answer the phone, but we return your calls generally within 24 hours. We do not sell or endorse any Medicare plan. We are trying to explain this to you and answer your questions so that you know what is in your interests. If you are interested in volunteering, besides the Medicare area, Pima Council on Aging offers other opportunities for volunteering, and you can speak to Christina Walker, our Volunteer Services Coordinator. And here, when we're talking about Medicare, I am going to explain the basics of Medicare. I'm going to tell you how you enroll in Medicare, how you make changes, and some of the current hot topics in the Medicare world. We are funded through the Administration for Community Living, the SHIP program, which stands for State Health Insurance Assistance Program, and the Senior Medicare Patrol, or SMP. Many people are aware that individuals become eligible for Medicare at age 65, and that is the most common way for people to become eligible for Medicare. The next most common way is through being on Social Security disability insurance for 24 months. At that point, people do become eligible for Medicare. The other things shown, ALS, kidney failure or end-stage renal disease, or certain kinds of environmental health hazard exposure, those are more unusual, and people in those situations can generally enroll more quickly in Medicare, and if anyone is affected by that, they should contact us. Medicare is managed by CMS, which stands for the Centers for Medicare and Medicaid Services, and people must be a U.S. citizen or lawfully present in the United States to be eligible for Medicare. We're going to return to this slide several times during our presentation, and you can notice the thick black lines in between. It's kind of like on a road. You are not supposed to be on both sides of the road at the same time. What this slide has to do with is that people get their Medicare benefits in two different ways. Some people stay on original Medicare, which consists of Part A and Part B, and generally they add a supplemental insurance for that, and they add a standalone Part D plan for drug coverage. What some people like about Original Medicare is that they can see any Medicare provider in the United States who is accepting patients. The other option is a Medicare Advantage plan, and that is sometimes called Part C. The Part C, or the Medicare Advantage plan, combines Part A and Part B so that someone has both hospital coverage and medical coverage. Someone who is on an Advantage plan would not get a supplement to that because that is covering all those pieces. And most of the Advantage plans, particularly here in Pima County, include Part D, or the drug coverage. Let's start with talking about Original Medicare, which came into being in 1965. Part A had to do with hospital insurance, Part B with the medical insurance. And as I said, people generally add a supplement, either a Medigap or some other kind of supplement, and people generally get a prescription drug coverage in the form of a standalone Part D plan. Part A, as I have been calling it, hospital insurance, is the coverage that gives people coverage if they are hospitalized. It also pays for some rehab and skilled nursing, generally right after a hospital stay. Medicare does not cover long-term care, just that skilled nursing after a hospital stay. And if someone is seeking hospice services, that is also a Part A Medicare benefit. When we talk about Part B, which is the medical insurance, that would be what is used if someone is on observation status in the hospital. Also, when people see doctors or have any kind of outpatient care or have administered medications to them in a doctor's office or a lab, that falls under Part B. Many of the preventive services, certain shots and screenings are Part B. Diagnostic tests like MRIs, CAT scans, and X-rays. The therapies like occupational therapy, physical therapy, and speech. Durable medical equipment, and an ambulance to the nearest hospital, and emergency and urgent care. Home health care may fall under Part A or Part B. Part A and Part B do not cover certain things. When we say that Part A and Part B do not cover prescription drugs, what we mean is that they do not cover the drugs that someone picks up at a pharmacy or gets through mail order. They would cover the medications that are done in doctors' offices or in hospitals. Medicare does not pay on dental care and dentures. It also does not pay for hearing aids or eyeglasses, but it does cover all the other things that would relate to health care related to hearing or eyes. Medicare does not cover cosmetic surgery or anything which is considered not necessary. Um, Alternative care is not covered, but certain acupuncture for lower back pain can be covered. And that custodial or long-term care that some people need in their later years is not covered by Medicare. Nor are things outside of the United States. The international travel is not covered by Medicare. We're talking about the costs of Part A, the hospital insurance. For most people, there is no premium for Medicare Part A. And that is because most people paid into Medicare during their working years or during their spouse's working years. You need to have 40 credits to have Part A, Medicare Part A, for zero premiums. And that is roughly the equivalent of 10 years of work. The slide also shows you, if you have less than those number of credits, how much it would cost per month to have that Medicare Part A coverage. But again, for most people, there is no charge for a premium for Medicare Part A. Now, we are talking about people on original Medicare. If someone on original Medicare is hospitalized, they would have a $1,736 deductible per benefit period in the hospital. A benefit period, unlike an annual or a monthly period, has to do with when someone has not received inpatient services for 60 days. So if I went into the hospital on January 1st, if I had to go back into the hospital on February 1st, I would still be in that first benefit period. But if I didn't go back into the hospital until March 1st or April 1st or something like that, then I would be in a new benefit period. If that means that for those first 60 days, I would have zero copay, but if my stay in the hospital goes longer than that, I will have a daily copay. As many of you know, these days most people are not in the hospital for 60 or more days, but there are some people with certain conditions who might be. If I have been in the hospital and had a 3-day hospital inpatient stay, and the doctors feel that I would be best served by going for skilled nursing or rehab, those first 20 days I would have no copays, but after that there would be a copay. After 100 days, I would be paying all cost. If I am getting hospice services, there is limited cost for me for paying for pain medications, and my family members might have some respite care, and some of that would be covered. But hospice under Medicare, does not cover room and board. So if I start hospice services when I am in a skilled nursing, I would have to start paying for that skilled nursing. What I should also say is that original Medicare does not have out-of-pocket limits, which is why many people, most people, do get a supplement to Medicare to help manage those costs. When we talk about original Medicare and the Part B costs, most people are paying a premium for Medicare Part B. And this year, in 2026, that premium is $202.90 a month. The reason I say that's what most people pay is people pay more if their modified adjusted gross income from 2 years ago was more than $109,000 for a single individual or more than $218,000 for a married couple. Also, if people's income is very low, sometimes people are not paying that Medicare Part B premium, and we'll be talking about that on a later slide. In addition, there is an annual deductible for Part B of $283. So the first $283 in services that Medicare accepts as Part B claims, the individual pays for. And then at that point, Medicare starts paying after that first 283, and generally Medicare is then paying 80%. The coinsurance being 20%, which would be on the individual or with one of the supplements. Also, some of the preventative services that Medicare covers is done at no cost to the individual. And again, original Medicare does not have out-of-pocket limits. That income-related monthly adjustment amount that I mentioned for the premiums, this is the chart for that, showing that again, for people who have income above $109,000 as an individual or above $218,000 as a couple, how much more they are paying for their Part B and also their Part D. So, as we said, when people are on original Medicare, many of them get some sort of supplement to manage their costs better, and we're going to talk about that now. A Medigap is an individual plan, and those are sold by a number of companies in the community. There are some people who might not need an individual Medigap plan, and those are people who have some sort of retiree health benefits. One of the most common ones is through the military, people who are eligible for TRICARE for Life or CHAMP VA. The other groups are people who are entitled to federal benefits, might have that rather than a Medigap. People here in Arizona might have a supplement through Arizona State Retirement System. There are still some private insurers or unions that offer some sort of supplement. The other supplement that some people get is Access, which is Arizona's version of Medicaid. And this is for lower income beneficiaries where Access becomes the secondary to their Medicare. We're going to talk about Medigaps. The Medigap pays all or some of your Part A or Part B costs. You have to have original Medicare, and you have to have both Parts A and B to get a Medigap. And someone who purchases a Medigap will see that the policy will say Medicare Supplement Insurance. Now, these Medigaps are standardized. The benefits that they offer are standardized by federal law. And there are 8 different kinds of plans: a plan A, B, D, G, K, L, M, or N. These are not the parts A and B and D of Medicare. These are Medigap plans. But if someone is looking at a G plan, a G from one company is going to be the same as a G from another in terms of what they are required to provide. They will have different pricing because different companies determine what they need price-wise differently. A few of the plans may throw in some additional benefits, but they are not required to do that, and technically they could stop doing that at some point. Here in Arizona, and this is true in probably 35 of the 50 states, Medigaps are not sold to people under 65. If someone already had one and moved here from another state, they could keep it. But in Arizona, they do not sell Medigaps to people under 65, though at age 65, someone would regain that right to purchase a Medigap. What you can see on this chart is the different types of Medigaps, the A, B, D, G, K, L, M, and N. What you see below that are the benefits that they are covering. That first tan line near the top says that Part A deductible, that's $1,736 that I said someone would owe in a benefit period if they were hospitalized. You can see that some of the plans pay that at 100%, and some of them only pay a percentage of that. The other or actually below the other tan line where it says the Part B coinsurance or copay, that 20%. You can see that, again, most of the types of Medigaps pay 100% of that. A few of them only pay a percentage. None of these plans pay that Part B deductible of $283, though some people on Medicare who are older may have an older plan, which is called a Plan F, that does pay that. But people who turn 65 after 2020 or January 1 of 2020 can't get that. When up at the top where we show the lowest approximate annualized premiums, those are the information that is provided to the Department of Insurance for the state. Those numbers are annual and those are approximate. What you would also see on that G column above there, you see where it says 480 HD. There is a G high deductible plan. And this year, that deductible amount is $29.50. So the premium is much lower, but the person who gets a high deductible Medigap is paying the amount up to $29.50 that the plan would otherwise be paying, and they're doing that to save on their premiums. Oh, I'm going to go back. Oh, it doesn't let me go back. All right, staying right here. This has to do with excess charges, which was also on that chart. And that has to do with the fact that we have 3 different types of providers. We have participating providers, we have non-participating providers, and we have opt-out providers. Opt-out is the easiest to explain. Those providers do not participate in Medicare at all, and Medicare will not pay anything towards services that you use with an opt-out provider. Fortunately, across the whole country, only about 5% or less of doctors have opted out of Medicare. The difference between participating and non-participating is that a participating provider agrees to accept Medicare's assigned amount. So if I went to a doctor who was a participating provider and they charged $100 and I had already paid my deductible and Medicare pays Medicare approves the claim, Medicare would then pay 80% of that claim. And any of the Medigaps that I would have, any Medigap plan that I would pay that remaining 20%, and I would pay nothing except continuing to pay my premiums. A non-participating provider accepts Medicare, but they may charge more than Medicare's assigned amount, and they may charge up to 15% more. So if I went to a non-participating provider and that doctor charged $115, Medicare is still only going to pay 80%. And if I had a Medigap plan A or B or C, D, or M, my plan would pay 20 and I would pay those excess charges of $15. But if I had an F plan or a G plan, they would pay those excess charges as well. If someone is looking to purchase a Medigap, this page may be useful for some questions to ask the agent or broker you're talking to. One thing to know is how long have they been in the market? What would the premium be? Is there an enrollment discount? Not that there's anything wrong with an enrollment discount, but it's good to know if you have one, because if it's going up because the enrollment discount is getting smaller each year and because the Medigap is gaining in price, you want to know how much it's going to go up, how long that discount is going to last. Many of the Medigap companies also throw in some household discounts. And you can always, when looking to purchase a Medigap, it would be a good idea to ask about the premium history to see how much it has gone up over the past couple of years. Most, if not all, of the Medigaps do what's called crossover billing, so that Medicare automatically sends the claim to that company. You might want to check that out and be sure of that. Also, and we will talk about this further in the presentation, but at times people might be in a guaranteed issue period, meaning they cannot be turned down for a Medigap, and they can't be even asked any questions about their Medigap. But if they are not in a guaranteed issue period, will there be a waiting period depending on a condition that that person has? So that is one way that people get their Medicare benefits. We'll come back to the drugs, the Part D later, but let's talk about Medicare Advantage plans. Medicare Advantage plans came about in 1997 when insurance companies presented CMS with the idea that they could offer something that was a managed care plan as a way of saving some money on Medicare, and that's what was done. It is another way to get your Medicare. The Advantage plans combine the Part A and B. Most also include Part D. You still have all the rights and protections of Medicare, which includes being able to appeal a decision and being able to complain if you are not treated properly. Advantage plans do throw in some extras. Some of them give you eye exams or dental cleanings, or maybe even a hearing exam and a gym membership. You will have to note whether the plan you are looking at does that, and the spreadsheets that you can get from us do give you some of that information. Because you are receiving your benefits through a private insurance company, you use that plan's ID card rather than your Medicare card when you see a doctor, though sometimes the first time you are seeing a doctor, they may want to see your Medicare card as well. If you are in an Advantage plan, you should not be enrolled in a Medigap. They don't work together. They don't give you more benefits. In fact, they also kind of confuse your coverage a little bit. And as of 2021, people with end-stage renal disease may enroll in Medicare Advantage plans as well. There are three types of Advantage plans here in Pima County. There is your HMO, which is a health maintenance organization. It is the most limited in the sense that you must use network providers within an HMO, or else they will not cover it. Your Advantage plan will not cover it. Though if you are away from home and it is an emergency, that would be covered, but sometimes the follow-up care you might need to be back in Pima County for. And generally, with HMOs, you need to get referrals to see any kind of specialist. Then there's something called an HMO POS, a health maintenance organization with the point of service, and they may allow you to get some services out of the network if you pay a higher copay. Different HMO POSs have different rules about how you get that prior approval and when they allow it. So it's really important that you know about the one that you have chosen to make sure you are doing things right. There are also PPOs, preferred provider organizations. Here, if you stay within the network, it will cost you less, but in some cases you can see outside specialists or outside providers. And so, again, with a PPO, you don't always need referrals for a specialist. Now, there are some providers who will not accept Medicare Advantage plan members, even if the person wants to pay out of pocket. So that would be something to check out if you are if you know that you are interested in leaving your Advantage plan for certain specific kinds of coverage. And again, as we said before, there are participating providers and non-participating providers. Non-participating providers don't have to accept Medicare Advantage members, even if that member wants to pay out of pocket. When we talk about the costs for Medicare Advantage plans, here in Pima County, we are considered a competitive market for Advantage plans. So many of our Advantage plans do not have a premium. But someone on an Advantage plan does still have to pay their Medicare Part B premium. And if they are subject to that IRMA for a higher premium, they would still be paying that as well. And while many of our Advantage plans do not have a premium, there are some that do, and some of them may have also a deductible, particularly for the drugs. And some do have a deductible even for other services. Since an Advantage plan does not charge you a premium, what happens is that people pay when they use services. So again, some of the Advantage plans don't charge anything for a primary care visit, but some do. Same thing for the specialists. There is a charge for the ambulance, and you can see on our spreadsheets how much that might be. There is a daily copay for an in-hospital stay. Some Advantage plans charge that for only 5 days. Some charge it for as many as 7 days. Also, if someone is getting chemotherapy medications, generally they are paying 20% copay. Their Advantage plan pays the rest. And similarly, if they are getting durable medical equipment, they are paying the 20% coinsurance on that. Now, while we talked about original Medicare having no out-of-pocket limits, Medicare Advantage plans do have an out-of-pocket limit, and each plan has a different one. So you have to look and be sure you know about your plan and what the out-of-pocket limit is. The out-of-pocket limit has to do with the services. It excludes Part D, that's on its own schedule, and it also excludes anything you might pay in terms of extra benefits like for dental. It is just for the services that Medicare does and would cover. And knowing your out-of-pocket can help you as well, and that helps people limit their out-of-pocket costs. Okay, so now let's talk about drug coverage, which came about in 2006. as they began to realize at that point was not having any drug coverage under Medicare was a problem, and so they added drug coverage. If someone is on original Medicare, they get a standalone drug plan. If someone is in an Advantage plan, they are using the prescription drug coverage of that plan. You must be enrolled in Part A or Part B. You can get you can get a drug plan with just Part A or Part B. Each plan, because they are run by different companies, each plan has a formulary, the list of covered prescription drugs. They have to cover something for every condition, but they don't have to offer everything for every condition. And if you are using, you would be paying full price if your drug is not in that formulary or if you use a non-network pharmacy. As I said, if you are on original Medicare, you can purchase that standalone Part D because your Medigap does not pay Part D charges. And if you are in an Advantage plan, you use the Part D that is associated with that Advantage plan. Most of our Advantage plans do include drug coverage. Here in Pima County, our cost for Part D, for a standalone Part D plan, we have a few plans that have zero premium. There are some that do have a premium. For HMOs and PPOs, generally it is included in the plan premium, and many of our HMOs and PPOs have no premium. And again, if someone is subject to that IRMA for having a higher income, there is an additional element of that which is for the Part D. There is a deductible for most plans on drug coverage, and what that generally means is for the higher tier drugs, it might mean the first couple times somebody picks up that drug, they are paying a higher amount because the plan is not paying anything on it till someone is out of the deductible. Most of the plans, but not all of the plans, do not include the tier 1 and 2, the old-fashioned generics, towards that deductible, but some do, and you want to know about that. Then, once you have paid the deductible, that's this year, that's $615, until your out-of-pocket spending hits $2,100, you would be paying copays on the, depending on the tier. But if you hit $2,100 during this calendar year, your copays are zero for the remainder of the year. What this means is there is an out-of-pocket maximum on the copays, including that deductible amount, that people on Medicare pay towards their drugs. And then everything resets for January 1. Now, it can be awfully hard for people to figure out what plan is going to be the most cost effective. And luckily, Medicare has helped with that. At the Medicare website, which is medicare.gov, this is our federal government's medicare.gov website, this is kind of what the landing page looks like. And that second icon says Find Health and Drug Plans. And if you click on that, you get into this and you tell them what zip code you live in and what pharmacies you would go to, and give a range of pharmacies. But then the Plan Finder, which is what this is called, has you put in the specifics of the medications you are taking. And you want to be as specific as you can be, because capsules and tablets may cost differently. And if you get 30 pills for the month, meaning 1 pill a day, it's different than if you needed 2 pills a day and needed 60 for the month. So you want to be as accurate as you can be. And this Plan Finder then sorts and shows you what is the most cost-effective plan for you. Sometimes it's not the one with zero premium. Maybe there's one with a premium that treats more of your drugs as tier 1 and tier 2, and that would save you money throughout the year. Some people are very able to do this by themselves, going to the Medicare website and doing this. But we also help people with this here at Pima Council on Aging if you think you're not quite ready to tackle it yourself. Also, you notice where it says log in or create an account. A good reason to create a My Medicare account is then each year during the open enrollment period, when you go in again to look at your drug plan for the following year and be sure whether the one you're on is the best one for the next year, if you have an account, it will help you by filling in most of the information about drugs that you have purchased so far this year. Some other tips for saving money while on Medicare. If your medication is on a high tier, ask the plan for a tiering exception. Your doctor may be able to help that. Perhaps it's that you have to take the brand name, that none of the generics work for you, and that if you ask, maybe they will make an exception for you. If they don't, you asked and it was a help. You can also ask your doctor about samples, and that can keep your drug costs lower. And if your medication is not on the formulary, perhaps it may be that you started on a new medicine in the middle of the year and it wasn't on the formulary. You, with your doctor's help, can ask for a formulary exception. And we would always suggest that you speak to the doctor or the pharmacist to know if there are some generics or other medications that might work just as well. Few more hints for saving money. Compare your plans during the open enrollments and special enrollment periods. Mail order may be less expensive, but not always so. The cost will be lowest if you use the plan's preferred pharmacies, then network pharmacies, but if you use an out-of-network pharmacy, you will be paying the full price. We would also say compare the cash price with your Part D copay. You can't use one of those GoodRx or Needy Meds coupons if you're putting it through your Part D, but if you found that you would save a lot of money just going through using a GoodRx coupon, you don't have to put it through your Part D. But I would advise you that if you have a few expensive drugs and running things through your Part D gets you to that 2100 sooner, then that might take you to where you're paying less money out altogether. Also, if paying out on some expensive meds at the beginning of the year is a hardship, all of the Part D plans, whether they are part of an Advantage plan or as a standalone or as part of retirement benefits, have to offer some sort of payment plan structure so that you could spread that 2100 out over the year. There are a couple other cost-related ways that people get some help, and those are the Medicare savings programs. There are 3 levels of Medicare savings programs. We call them QMB, SlimB, and QI1. The QMB is for the people with the lowest incomes. And folks who qualify at that level, in addition to having Medicare, may be eligible for access and may enroll in an access plan. And then the Medicare Savings Program pays their Part A and Part B premium and pays copays and deductibles and lowers copays on drugs as well. SlimB and QI1, if someone qualifies at those levels, the state pays the Medicare Part B premium, but they would not be eligible for access, though their Part D costs would be lowered. There is also Altex, Arizona Long-Term Care System. It is a part of Access, but it is not a part of Medicare. It provides long-term care in assisted living facilities or nursing homes and provides in-home care for people who are staying at home rather than being institutionalized. It is based both on income and assets and also the level of care that people need. We put this slide here to tell people not to give away their assets because that could affect their eligibility. Also to tell you that PCOA offers a class on All-Tex, and you can call our helpline about that. But this is not a part of Medicare per se, but it is a part of access. Okay, this is where we would take a break if we were in person. I'm going to just continue. So when we are talking about how people make the choice as to which Medicare, whether to go with original Medicare, whether to go into an Advantage plan, there are various factors that people need to think about. One has to do with the access to providers and this idea of referrals and whether you want to see providers without having to get a referral from an HMO primary care provider. Some people are very used to having to see their primary care doctor before they see a specialist. Other people are really uncomfortable about that and really want to go to a specialist without having to get a referral. Excuse me. So that's something to think about how much that impacts you. And that connects as well with provider choice. Some people, so the issue of provider choice, for some people, it is very important that they be able to choose their own doctors and hospitals. Other people are less concerned about that. It may also have to do with whether you want to go outside of Pima County, whether at times you'd want to go up to Phoenix, or even out of state if you were told that someone was a better fit for your condition. Again, these are not absolutes. It has to do with how someone feels about this. But again, the more someone wants that ability to make the choices without any limitations may lead someone to want to go with original Medicare and a Medigap rather than an Advantage plan. It's something to think about. There are some, as we talked about before, some places of providers who do not take assignment. And one of the big ones there is the Mayo Clinic up in Scottsdale. So if someone has in their head that they would always want to go there for a second opinion, they do not take Advantage plans. So it is worth knowing that. The other issue, again, about provider choice is how much you're going to be traveling. Some people may be hoping once they're on Medicare and retired to travel a lot and only stop back in Pima County every now and then. Other people may not be traveling all that much. If you expect to be away a lot, again, original Medicare with a Medigap would give you more coverage in more places, whereas if you don't think you're traveling much, an Advantage plan with its networked coverage may work just as well. When we talk about the health concerns, current and future concerns, again, some people may be thinking that in the future they want to have some of these choices, and that may lead them to make a choice one way or the other. If they know that everyone in their family has had certain conditions, they may be wanting to prepare for that as well. Another thought is if I go with original Medicare and a Medigap, putting aside drug costs, once I have paid my Medicare deductible, then mostly it is cost sharing between Medicare and my Advantage plan, not my Advantage plan, my Medigap plan, which would mean all I'm paying is my premiums. Whereas if I am in an Advantage plan, I am going to have costs when I have medical services done. Some people really like evening it out. Other people hate the idea of paying premiums when they're not using those services. So that is something to think about. You also want to think about using that Medicare.gov for the plan finder to be sure you're finding the plan that is going to cost you the least on your medications. And again, if you are under 65, you can't get a Medigap. but you can when you turn 65. And those extra benefits, the hearing exams, the vision, the dental, while those are very important, and if someone signs up for an Advantage plan, I think it is great to take advantage of those kind of extra benefits. However, make sure that a particular plan is going to work well for you before you before you are concerned about those extras. And if there are some doctors that you have already been seeing and want to stay with, it would be, and you are approaching Medicare, it would be good to ask about whether they do take, which Advantage plans they take if you are considering that. So again, this is the choice. Some people go with original Medicare, they get a Medigap and a standalone Part D. Some people join an Advantage plan where their Part D is included. Some people are entitled for a retiree plan that would work with their Medicare. Some people are lower income and would be eligible for access as their secondary to Medicare. You have probably seen some of those commercials which say you may not be getting all the Medicare benefits you're entitled to. They are promoting Advantage plans, and you again want to be sure that whatever plan you pick is going to work well for you. So on this chart, we are attempting to look at how the costs compare. But I can show you when we look on original Medicare. Again, we know that nearly everybody doesn't pay the Part A premium. Nearly everybody pays the standard Part B. And then there's a variety in terms of the Part D premium. And depending on which Medigap plan they chose, what they are paying for that. So it gets to be people on original Medicare with a Medigap can have a pretty good idea of what their costs are going to be, with the exception of what their share of drug costs is going to be, though they know it's not going to go over $2,100. It is harder for me to tell someone what they may be paying when they are in an Advantage plan. Because if we had a couple of people go into the same Advantage plan, but they have very different health issues, their costs may be quite different. But you can know with Advantage plans what the out-of-pocket limit is of just how much it could go up to for that calendar year. What to consider when choosing an HMO or PPO. So one thing is about the plan's network. How large a network is it? Some of the plans have very large networks. Some are a bit smaller, and you want to know that before you sign up with something. As I said, it's a good idea if there are some doctors you really want to stay with to make sure that they are in that plan's network. And with the pharmacies, if it is very important to you to stay with one pharmacy rather than making a switch, you want to make sure that whichever one you are interested in is in the network of the plan you are choosing. You want to check again with Plan Finder to see that your prescriptions will be covered. When you travel outside the plan service area, what do you need to know? What situations would be considered emergencies? Some of the larger Advantage plans do some contracting with plans in other places. So you might be able to get some routine services, and you would want to check with that customer service of your plan to know if that's something you can do. You want to understand how to take advantage of those extra benefits, those extra services. And is there any cost to this plan? As I said, most of our Advantage plans do not have a premium, but you want to be sure to know if it does, and how much your prescriptions would cost on that plan. If you see our spreadsheets, you will see that there are star quality ratings. These are done by Medicare, and it is on a 5-star rating system. And many people use that as a way to be sure that they're getting something which is not considered poorly run, though mostly you want to make sure it is meeting your needs in terms of the doctors and the prescriptions as a way, whether it's going to work well for you. That may matter more than the star quality. There are also some advantage plans for special needs. There are, for chronic conditions, there are advantage plans for COPD, diabetes, heart care, end-stage renal disease. And where it says institutional care, some nursing homes and assisted living facilities are networked with advantage plans so that nurse practitioners or physician assistants come to the nursing home. Same thing, there is a HMO POS who does the same kinds of things. It does not mean that someone who has one of these conditions has to join these plans, but they may want to look into it because it may be an option for them and may suit them well. There are also three plans for the people that we call dual eligible. Dual eligible means they have Medicare and they have access, our Medicaid system. And generally, the goal here is to have a advantage plan that is linked to an access plan so that someone can be certain that all the providers they see take both their advantage plan and their access plan. Let's talk about the ways that people enroll in Medicare. As you see here on this slide, we have Social Security's website and Social Security's phone numbers up there. And that's because even though it's Medicare, you enroll through Social Security. Unless you worked for the railroads, and then it's the Railroad Retirement Board, and they are a little bit different. Um, and again, most people do this via the website. There are ways to enroll in Medicare online. Everything starts with Medicare Parts A and B. That's the original part from the feds, and that is what people enroll in with Social Security. Now, there are some people who do not need to do anything to enroll in Medicare, and that's because they are going to be automatically enrolled. And the people who will be automatically enrolled are people who are already receiving Social Security or Railroad Retirement Board benefits for at least 4 months before their 65th birthday. Also, if people are on disability and they have now hit their 25th month of disability benefits, they are automatically enrolled in Medicare. And people with ALS, as soon as they enroll, they become eligible. Those folks will not be notified that it's time to enroll in Medicare. The Medicare card will be sent in the mail. So one thing we do remind people is to make sure that Social Security has your correct mailing address. And if someone needs to delay Part B or wants to delay Part B, they can do that even when the card is sent to them through an automatic enrollment. If you get the card in the mail because you are already on Social Security and you want an advantage plan or a drug plan, you must enroll no later than 2 months after your Medicare effective date. Many people are not automatically enrolled, and that's because many people are not yet taking Social Security when they hit 65 and are ready to enroll in Medicare. So the initial enrollment period that people have is 7 months. It's the 3 months before their birthday month, it's their birthday month, and it is the 3 months after. You can enroll anytime during that time period. If you do it in those 3 months before your birthday month, then Medicare will start your birthday month on the first day of that month, even if your birthday is on the 31st. If you enroll at that point in your birthday month or in the months after, then your Part B starts on the first of the next month. But this is the time frame, and again, this is the time frame to add a standalone drug plan or enroll in an advantage plan. This saves 7 months. If you waited till the 4th month after your birthday month, you would have to wait longer because you would not be eligible to enroll at that time. Here's a goofy Medicare thing. If your birthday is on the first of the month, then your initial enrollment period is the 4 months before and 2 months after, and your Medicare could start a full month before. If your birthday was on July 1st, Medicare would start on June 1st if you enrolled in that earlier period. Then we start looking at how to add an Advantage plan and or a drug plan. How to enroll in those. You can enroll in an Advantage plan or a standalone Part D by calling Medicare. Also, if you use the Plan Finder on Medicare.gov, it does have an enroll button right there. You can also contact the plan directly, and our spreadsheets have that information, or you can use an agent or a broker. If you use an agent or a broker, they should not be charging you. They get paid by the company that you are enrolling with. You must be enrolled in both A and B before signing up for a Medicare Advantage plan. And then for a standalone Part D, you could be enrolled in both, but you also could be enrolled in just A or just Part B. To enroll in a Medigap, the rules are a little bit different. To enroll in a Medigap, you can contact the plan directly or through an agent or broker. You have to have original Medicare, both Parts A and B. You can buy a Medigap anytime an insurer is willing to sell you one, but you may not purchase a Medigap if you have access or are under 65. The rule about access has to do with about a decade ago in various states of the United States, unscrupulous agents enrolled a lot of people in Medigaps, and they were people who did not have the money to pay for them. And by enrolling them, they made it harder for them or less timely for them to get into an Advantage plan. So the rule came down that they could not sell Medigap policies to people who were on Medicaid or Access. There is a period called the Medigap guaranteed issue. You cannot be denied or charged a higher premium if you apply for a Medigap within 6 months of your Part B start date or your 65th birthday if you had been receiving Medicare due to a disability. What this means is if someone is new to Medicare, just turning 65, and they want a Medigap, they cannot be asked any questions about their medical history. Whatever company they want to purchase a Medigap plan from has to sell it to them at that time. Now, if they had no insurance coverage prior to getting that Medigap, they may have to wait up to 6 months before certain pre-existing conditions are covered. There are also a few other guaranteed issue periods that give people 63 days in order to get a Medigap with no medical underwriting in this kind of guaranteed issue. And that would be if someone had been in an Advantage plan in one area and moved away from that Advantage plan area, or if their Advantage plan or Medigap plan was discontinued, or any kind of retirement health benefit that was paying secondary to Medicare is discontinued. So for some people, this guaranteed issue is super important because prior to age 65, they've had some sort of very major health issue, and getting the Medigap without medical underwriting would be very important. Other people like it just so that they know they can have it, so that if anything comes up later on, they have this coverage. We talk about this retiree health benefits. So one of the things is with some companies, if you don't take those retiree health benefits when they're first offered, or you disenroll, some of them don't let you get it back, some do. And you want to know if that's the case with any Medicare, not Medicare, retiree health benefits that you have. You also want to be sure if you've been covering any family members through retiree health benefits. If you want to make a change, you want to make sure you know what you're doing to cover the family members. And this comes up because we do sometimes see someone enroll in an Advantage plan or a drug plan or a Medigap plan, and they had had some benefits through some sort of retirement plan, and by signing up for something new, they give those up. So you want to really understand those benefits before you take action which could take them away from you. Okay, so some people might be age 65, but they're not ready to take Medicare benefits. Let's talk about that. Premium free Part A. Most people are entitled to premium free Part A because they or their spouse worked at least 40 quarters, 40 units. It is considered up to 4 credits a year, roughly 10 years of work. Those folks have zero premium for Part A. So the important thing here is if you are eligible for free Part A, you may enroll with no penalty anytime during or after your initial enrollment period. If you are over 65, that coverage start date will be retroactive up to 6 months from when you sign up, but no earlier than your 65th birthday. Let me unravel that. One thing is, if you are entitled to premium free Part A, anytime after 65, you can enroll. The reason we mention the retroactive Part A, if you sign up when you are over 65, is that if you have continued working somewhere and have an HSA, a health savings account at work, you want to be sure that you have not been contributing to it in those 6 months, because the rules are you can't be contributing to an HSA and have Medicare at the same time. So for someone who continues working past age 65, if they have an HSA, they want to be careful to not have overlap because it does create a small tax assessment on you. And that is something we know more about. And if you have any questions about that, you could check with us as well. If someone would have to pay for Part A, meaning they did not have the work credits to have it for free, the reason they might not want to delay Part A is because they would have a penalty, an additional 10% of the Part A premium every month for twice the number of years they could have had it but didn't sign up. So those folks may want to sign up right on schedule, though there are some people who do not have the credits for Part A who are able to get some of the same kinds of benefits in other ways. So if someone is impacted by this, they want to get in touch with us. Delaying Part B. Many people delay Medicare Part B, and the reason for that is that they are still working somewhere and they have medical benefits where they work. The penalty for delaying Part B could be an additional 10% of that Part B premium for each full 12 months that you could have had Part B and did not enroll, and that penalty lasts for as long as you have Part B. But there is no penalty for delaying Part B if you have coverage through your or your spouse's current employer, and that current employer has at least 20 employees. If someone is disabled, they could delay that Part B if the coverage is through theirs or a family member's current employer, but the current employer needs to have 100 employees. So if I have delayed Part B because I have coverage through a spouse, I have to enroll during this special enrollment period, which is 8 months from that time that that coverage ends or the employment ends. There are some specific forms for that. We have those forms, as does Social Security. And while there is 8 months to get the Part B, there's only 2 months to get the Part D or the Advantage plan. And I should say that COBRA, VA, retiree benefits, and Marketplace do not exempt you from this penalty. It has to be someone's work-based insurance. In addition to that initial enrollment period, there is a general enrollment period every year, January 1st through March 31st. That's when someone would sign up for Part B, and if they missed an initial enrollment period or a special enrollment period, if they're subject to that premium Part A, that is when they could sign up for it. And the coverage starts the first day of the very next month. If someone is subject to penalties, those penalties are added on at that time. The Marketplace, ACA, Obamacare. We advise people that if they have been getting their health insurance through the Marketplace, they should transfer to Medicare when they are first eligible. And the reason for that is that those subsidies end when they are eligible for premium-free Part A, whether they sign up or not. So some people have stayed on their ACA plan and then at tax time found out that they owed a penalty because their subsidy went away. So we're helping people to avoid the late enrollment penalty and also having their subsidies go away and not expecting it. So we do advise people to switch to Medicare when they are first eligible. Those Marketplace plans are not automatically canceled, so you do need in that last month before you switch to Medicare to notify the plan of your switch, making sure that you have taken care of family members who may still be on the Marketplace. COBRA. Many people know about COBRA. It is the insurance that people sometimes can or choose to keep when they lose work-based insurance. But delaying Part B because you have COBRA does not exempt you from the Part B late enrollment penalty. And COBRA is not a Medicare supplement. So there are some things, if you have Medicare and you become eligible for COBRA, then Medicare may be primary to the COBRA. The main thing is that in the long run, taking Part B when you are eligible will be less costly than staying with COBRA and facing late enrollment penalties for not signing up on Medicare. Part D. Part D, the drug plans, there is a penalty. Luckily, we don't have to figure it out. The feds do that because it is an additional 1% of the current base beneficiary premium, which is $38.99, added to the monthly premium if you did not enroll in a Part D for 63 or more days after your initial enrollment period. And that penalty lasts for as long as you have Part D. Now that would be if someone had totally gone without any drug coverage. There are people who have what's called creditable coverage, and then there would be no penalty. People who are able to pick up their prescriptions at the VA, that is considered creditable. Many group insurance or retiree coverage is creditable coverage, and they send you notices every year telling you whether your drug coverage is creditable. And if it is, and you are of Medicare age, hold on to those notices because that's what helps prevent you from having this penalty. Luckily, here in Pima County, we do have some standalone Part D plans that have no penalty. So someone could have coverage and it would not necessarily cost them. If someone has had other creditable coverage, they would avoid the penalties by enrolling in Part D within 2 months after that creditable coverage ends. Okay, so now that people are enrolled, how do they make changes? Every year, October 15th through December 7th is the annual open enrollment period. Very easy to change Advantage plans. It is also easy to change or add a standalone drug plan, and someone can change from original Medicare into an Advantage plan or from an Advantage plan into original Medicare. Those changes become effective January 1. There is also from January 1 to March 31st something called the Medicare Advantage open enrollment period. And this is for people who are enrolled in an Advantage plan as of January 1st. During this period, they can switch Advantage plans or they can leave their Advantage plan and go back to original Medicare, and they can get a standalone drug plan at that time. With both periods, if someone is looking to leave an Advantage plan and go back to original Medicare, if they are presuming that they will get a Medigap, we would advise them to check on that first, to apply first, so that they know that they will get that Medigap before they give up their Advantage plan. The annual notice of changes and the evidence of coverage. The annual notice of changes is a document sent to Medicare Advantage plans and Part D plans each fall, usually in September. It lets them know about any changes that are coming up for the following year. What's really important is to look at that so that if something is changing and it's not going to work as well for you, like something is no longer going to be on the formulary and it's a drug that you like, or your provider is leaving the group, or that there's now going to be a premium where there wasn't. This is the opportunity before the open enrollment period to check and know whether your current plan is going to work for you for the following year. When you're in, you can make these changes. You are in a special enrollment period if you move from your plan's coverage area, if you move into or out of assisted living, if you have developed a chronic condition covered by a special needs plan, if your retiree plan is permanently ending, if you wanted to enroll in a 5-star plan. Sadly, we don't have any in Pima County, but if we did, that creates a special enrollment period for everyone. Or if your plan is discontinued. What I would also add is if there are any questions, if something seems to be changing and you're not sure how it impacts your choices, that is a good time to contact us. Also, for people of limited income, and by this I mean the people who are on access or who are enrolled in Medicare savings programs or who are getting the extra help with their drugs, they are allowed to change more often. They are able to switch from an Advantage plan into a standalone Part D or from one standalone D to another, though they may not enroll in a new Advantage plan. To change Advantage plans, you simply enroll in that different Advantage plan. To enroll or change your drug plan, you just enroll in a standalone drug plan. To leave original Medicare for an Advantage plan, you enroll in the Medicare Advantage plan. To leave an Advantage plan for original Medicare, you just enroll in a drug plan, or you could call Medicare, or you could sign a letter with your Advantage plan saying that you are disenrolling. The big thing for Medicare is they don't want people in a standalone drug plan and an Advantage plan at the same time. So enrolling in an Advantage plan disenrolls you. Enrolling in a standalone plan disenrolls you from an Advantage plan. Enrolling in an Advantage plan disenrolls you from a standalone drug plan and from original Medicare. Switching Medigap plans. So as we spoke about earlier, that guaranteed issue period is very important for some people. And I bring that back up because some people do not change their Medigap, because if they're not in a guaranteed issue, they kind of know from their health issues that some of these other companies would not take them. But again, if someone is in a guaranteed issue, you cannot be denied or charged a higher premium if you enroll or switch Medigaps during your initial enrollment period, and if they are willing to sell it to you at later times. What we say is don't give up the one you have unless you're certain you're able to get a new one. There are two other guaranteed issue periods. So let's say someone joined an Advantage plan when they were first eligible for Medicare at 65. They have that first year to try out that Advantage plan. During that first year, they could switch to Original Medicare, and they are still guaranteed the right to buy any Medigap sold in their area. The other one works in a way in reverse. If someone started with Original Medicare and a Medigap and then 1 year decide to switch to an Advantage plan, they have 1 year to try it out. But if they want to go back to Original Medicare, the only guaranteed issue is for that Medigap that they had before. Let's talk about paying premiums. If someone is already on Social Security, or Railroad Retirement Board benefits, Social Security takes those Part B deductions right from your Medicare. But since many people are not yet on Social Security when they start Medicare, they can make payments. Medicare bills quarterly, although they bill monthly if you are subject to the IRMA. You can pay with a credit card, a bank check. If you create a My Medicare account, you can go to it and make the payment right there at the Medicare website. Federal retirees can have premiums withheld from their annuity payments, and you can set up an automatic withdrawal via Easy Pay. For the other things, the Medigap, the drug plan, or the Part C, depending which ones have a premium, you can create automatic deductions. Some of them will still send monthly statements or coupon books, but they seem these days to really like automatic withdrawals. Okay, so let's talk about a few of the other things which can come up. People have heard a little bit about observation period. And what we're showing you on this slide is that it doesn't always look that different. This is someone goes to the emergency room, and sometimes they are not admitted to the hospital. Instead, they are kept on observation. And as we say, that observation could last more than 1 day. So one thing is, if I am an inpatient, then I have that big deductible that my Medigap would pay, and I would meet my qualifying stay for skilled nursing if I am in there for more than 3 days. If I am on observation, then everything is going through Part B as coinsurance on all the services that are done. I may have difficulty getting my drugs when I am in the hospital. I may have to use that hospital pharmacy and then try and get reimbursed from my Part D. So it creates a little bit of an issue whether I am on inpatient or not. Another thing which comes up in the hospitals is if I think that I am being discharged too soon, I don't feel medically ready to leave, I can appeal that before leaving the hospital. All of the discharge staff know about Commence, which is the agency that deals with that, and I am covered while I am appealing that decision for me to leave the hospital. If I am an outpatient and on observation, and I am on observation for more than 24 hours, they need to give me this notice which says why I'm an outpatient rather than inpatient. And while I can't really appeal the decision to be on outpatient, I can ask questions and I can understand the implications of being an outpatient rather than being admitted to the hospital. Another form that comes up for people on Original Medicare, and this could come up during observation, but it can also come up at a doctor's office, a lab, or with durable medical equipment, is this Advanced Beneficiary Notice of Non-Coverage. And this is if a provider doesn't think Medicare is going to pay, they ask us to sign this, and there are 3 options. One is do it anyway, bill Medicare, and I'll appeal it if Medicare doesn't pay. I have to know that there's no guarantee that Medicare will pay, but that's how we want it done. Option 3 says, don't do anything. I'm going to go home. I'm going to ask my doctor more. I'm going to wait and do this. Option 2 says, do it and don't bill Medicare. And in general, we wouldn't be recommending that. But if this is for something and they tell you that they're not certain that Medicare is going to cover it and they are going to charge you just something very limited, which you are willing to pay, some people may choose to do that rather than going through Medicare and paying if the appeal is unsuccessful. Few other things. There are a lot of marketing scams out there, and these are part of the fraud that comes with Medicare. They say that Medicare is calling. There's something like 60 million people on Medicare, so Medicare does not do very much calling. Offering of free services. Again, these are generally scams. If someone is on the phone saying it's Medicare, it is most likely a scam. Medicare has made more stringent rules for how plans can and can't contact you for marketing their services. They can't market door to door. They can't make unsolicited calls. They can't say that they are approved or endorsed by Medicare. If you ever have any questions about that, you can always contact us. A couple years ago, there was a big scam about new Medicare cards. When they would do this, they were really trying to get your Medicare number and your banking information. Medicare is not sending new cards. You've probably seen a lot of ads and probably gotten a lot of mail. Those are done by some very aggressive marketing clearinghouses. They are really just trying to push you into signing up for something, and they aren't local. They do not know what is in your interest. While it is never our job to tell you what to do, if I could tell you one thing, it would be not to answer, not to call back on things you see on the television or on the computer or on some of the mail you get. This one, here's one, and look, they're telling people about the Medicare savings programs, so it must be useful. But this is not an official notice from Medicare. They are trying to get you to sign up, but they are not really offering you anything. This was a commercial we used to see on television. Have back pain on Medicare? Call us. Will you qualify for this? So when we look at the little letters, among it, it says, I am aware of my rights to protect my privacy, and these rights are waived. I consent to receive information on products not limited to support braces. If I am on a do not call list by opting in, I am waiving this right. So again, I would say don't answer the ads on TV about Medicare. With this specifically, when they're talking about some kind of durable medical equipment, you have to have a doctor's order. So they are maybe having a medical person sign off. You're supposed to have a doctor to ensure the proper fit. Medicare only pays for a basic model. And the bigger thing is, let's say they give me some sort of brace, but it doesn't do me very much good. If Medicare paid for it, they're not going to pay for new equipment for another 5 years. So again, if you need help, it's better to see your medical provider. Medicare sends out summary notices, and the Advantage plans, Medigap plans, and drug plans send out explanations of benefits. You want to be sure that Social Security and all of these companies have your correct mailing address. You want to be sure that the doctors' names are correct. Sorry. I'm so sorry. It's okay. You want to look at the MSN or this EOB. Do you recognize the names of the doctors? Do the dates match when you've had something done? Are the services correct? One thing is that if somebody's truly using your number fraudulently, you could see something that has nothing to do with you. If there's just a mistake, you want to know that too. And also, from the Medicare summary notice, if Medicare didn't approve something, you have a certain amount of time to appeal that decision. But if you don't, that doctor or provider might try billing you to collect. So you want to look at your Medicare summary notices. You can arrange to have them all online, and you can look at them there as well in your My Medicare account. There's a lot of Medicare fraud, sadly, 8 to 10% of Medicare spending, roughly 60 billion a year. The way you can help us reduce that amount is to protect your Medicare card. The only person who should need that card is a medical provider. You want to look at those summary notices for any mistakes. And if you think there's anything fraudulent, you can contact Medicare or you could contact us. And help is available. Here in our SHIP program through Pima Council on Aging, our role is solely to answer your questions. You can call us or email us. As I said at the beginning, generally we don't answer that phone, but we make our calls back within 24 hours. We have volunteers here Monday through Friday, morning and afternoon, attempting to ask your questions. I know Medicare can seem very confusing. It gets easier, and we as volunteers here do our best to help make it make sense to you. I'm glad you listened to this presentation, and please call us with your questions. Thank you very much.